Let's just dive right into this explainer. Because if you're a parent, or honestly, just a human being breathing air on this planet, you have absolutely faced this scenario. The endless runny nose. You know the drill, right? You've got the giant box of tissues on standby, you're brewing up some warm tea, and you just naturally assume you've caught yet another standard bug. Well, today we're going to completely reframe what's actually happening behind all that congestion.
So you kind of have to ask yourself this relatable little medical mystery. Is every single runny nose actually a cold? We are so deeply conditioned to associate any kind of nasal congestion straight up with being sick. But the slightly ironic truth here is that no, not every runny nose is an infection. In fact, a lot of the time, there is zero virus and zero bacteria attacking your body. None whatsoever.
And here is the absolute bombshell. Overcleaning is actually creating the problem. I know, it sounds crazy, but our modern, well-intentioned attempts to aggressively sanitize our homes, especially around little kids, are literally making this runny nose issue much, much worse. We think we're doing the right things, scrubbing away all the microbes, but the clinical data is telling us a fascinatingly different story. Okay, let's get into section 1. What exactly is allergic rhinitis? Simply put, allergic rhinitis is just your immune system totally overreacting to normally harmless stuff. We're talking dust, pollen, everyday cleaning chemicals, or even animal dander. And again, completely without a viral infection present. It's not a disease in the way we usually think of one. It is essentially a bored, untrained immune system freaking out over everyday microscopic particles. Your body is basically throwing a massive temper tantrum over a tiny, harmless speck of dust.
Which naturally leads us to section 2, the diagnostic tool. Let's figure out cold versus allergy. So how do you actually diagnose this confidently at home without running to the doctor every 5 minutes? You just have to look closely at the symptoms. A typical viral cold brings the whole package, right? A fever, profound fatigue, they don't want to eat, and just a general feeling of being completely unwell. But with allergic rhinitis, even with the sneezing, the heavily blocked nose, and that clear watery discharge, the person actually feels totally fine. They're bouncing off the walls, full of energy, eating perfectly normally. They just happen to have a leaky faucet for a nose. That huge contrast in energy, that is your biggest clue.
All right, moving on to section 3, the sterile home problem.
You really have to wonder, why is this non-viral runny nose suddenly everywhere? Well, just look at our modern environment. The culprits are all around us. Plug-in air fresheners, chemical sprays, harsh laundry detergents, and a massive amount of antibacterial products. We're constantly subjecting ourselves to this relentless barrage of chemicals. We've fundamentally transformed our homes into these overly sterile bubbles. Every single time we spray a scented mist or aggressively wipe down a kitchen counter to make it hospital-grade clean, we're actually wiping out the natural environment our bodies were literally built to interact with.
The core mechanism at play here is actually pretty straightforward. Your immune system is designed to train every single day by interacting with bacteria, dust, and natural particles. Think of your immune system like a high-performance athlete. That athlete desperately needs daily practice to know exactly what to fight and how to behave on the field. If you lock that athlete in a perfectly sterile, empty room with zero practice, the moment they step outside, they're going to panic. And that is exactly what happens to your immune system when it gets deprived of its daily workout with ambient bacteria. And that brings us to a really fun twist in section 4, the pet immunity paradox. This is super fascinating. Logically, you would probably assume that a shedding, drooling dog running around the house would automatically trigger way more allergies, right? But paradoxically, children growing up with pets, especially dogs, often have far fewer allergies. Why is that? Because dogs drag the outside world in. They bring dirt, bacteria, and natural exposure right into the living room. The pet essentially acts as a delivery system for those vital training bacteria we just talked about, which keeps the child's immune system active, balanced, and perfectly exercised. So we really need a major paradigm shift here. Overcleaning is not health. It's actually imbalance. Now, obviously, I am not saying kids should be living in absolute dirt and filth. We for sure still need basic, common sense hygiene. But an artificially sterile home just creates a hyperactive, confused immune system. True health relies on maintaining a really delicate balance with our natural, microscopic world. Let's break down how this develops in section 5, age-specific allergen triggers. These triggers actually evolve as a child gets older. For the really young kids from 0 to 2 years old, the triggers are almost exclusively indoor environment allergens, which makes perfect sense, right? Toddlers spend the vast majority of their time inside, crawling all over the carpets and breathing indoor air.
But as we cross that 5+ year mark, there's a very distinct shift. External allergens, things like pollen, plants, and seasonal triggers, become the primary culprits. Understanding this timeline is crucial because it shifts our focus from constantly mitigating indoor dust for toddlers to tracking outdoor pollen for the older kids. So, what do we do about it? That's Section 6, Environment First Treatment.
How do we actually fix this without just reflexively reaching for a bottle of cold medicine? Well, there's a strict hierarchy to follow. Step 1 is the most obvious, but honestly the hardest. Remove the allergen from the environment if you can. Step 2 is saline nasal rinsing, just using simple salt water to physically flush those irritating allergens right out of the nose. Step 3 is antihistamines, but definitely chosen in consultation with a doctor. And finally, Step 4, for the more severe cases, involves local nasal anti-inflammatory sprays. The massive takeaway here, a simple, physical saline rinse should always happen before you escalate to localized medications.
And this brings us to the absolute golden rule of this whole explainer. Medicine is not your first solution. Your environment is. Look, modern medications are incredible, absolutely, but we have to prioritize adjusting our living environment first. If we just ignore the environment, the medicine is nothing more than a temporary bandage over an ongoing underlying problem.
Which leaves us with a final, pretty provocative question to chew on. Are we fighting the nose, or are we actually fighting our own environment? Allergic rhinitis is not some disaster that needs to be blindly medicated away. It's an alarm bell. It is literally your body telling you that your living environment and your natural immune system are entirely out of sync. Your goal shouldn't be to over-treat the nose. Your goal is to understand it, balance your environment, and give your immune system the natural world it is quite literally begging for.